time, schedule a colon screen without an office visit with that physician. That all takes, maybe 3 hours, and then you're back to work. Ask yourself the question, how long that takes you now. How many half days do you take off away from your family or for your work? Or if you're an employer, how much does your employee take off to go do those things? What are the financial implications of that? Not only for you personally, but again, for your employer or your family in terms of your productivity when you're not present. This type of visits happens dozens and dozens and dozens of times every single day at Legacy Medical Village. Let me move quickly to an acute type visit, something a little bit more serious. Someone calls with a stomach ache. We tell them to come right in every day. We see you the day you need to be seen, when you need to be seen. If we suspect an appendix or an obstruction, something surgical, we would call over our general surgeon that's in the building, have them take a look at him real quick, maybe get an imaging film, an x-ray or a CT scan if needed, and then get them directly admitted to the hospital. This would take, in general, and does on a daily basis, about 2 hours and spends about $1,000. In the old practice of before I had Legacy Medical Village, that we often really couldn't find a surgeon. They'd end up going to the emergency room where they would have made the wait much, much longer, and you'd have at least a $4,000 plus bill. Very different experience. Very different experience. So that's just a little example of what we've done to look at access to care. Because we don't think that utilization of emergency rooms are necessarily always the appropriate thing, but too often people are using that as their health care. We would like to be, as primary care physicians, part of the solution, certainly, and I think everyone agrees with that, no matter what side of the aisle you sit on. Primary care physicians in general have a pretty tough workload and carry a pretty big burden, and are only going to have to carry more no matter what comes out of reform. But I will tell you, we're happy where we are in Plano, and some of that's just because it's a great place to live, right? But secondly, it's because our patients are happy. Our patients are happy with the access they have, the coordination of care that they get, and the communication that they receive from their physicians and specialists. When I look at what's being proposed in Washington, again, I do appreciate the bipartisan recognition of primary care and the desire to invest in the patient-centered medical homes, which is a big buzz phrase now. But I do not know for sure if a public plan and a board telling me how to practice is going to allow practices like ours, or physicians who haven't gone to the level that we have, to be able to innovate to the kind of things we do. Evidence-based medicine is very important. It's something I very much believe in, but it never should supersede a patient's particular circumstances and what is known by their primary care physician. I guess in closing, again, in primary care physician, we're a little bit more busy to be involved in things like this too often. I do appreciate the opportunity, but in general, anything that supports the preservation of patient choice and the doctor-patient relationship, we are certainly for. And anything that is against that, just give me a few more words. No, anything that preserves that, we're for. Anything that disrupts that, we're against. And I thank you all for your time tonight.
Thank you, Dr. Crow. I forgot to ask all of you to turn off your cell phones when we started here tonight. But if you haven't done that, please turn that off. Judge Lynn Whitley is from Tarrant County, and he's the Vice President of the National Association of Counties, and they have done some very interesting things in controlling the cost of drugs, and we want to hear about that tonight, so please give him a warm welcome.
On behalf of the National Association of Counties, I'm pleased to be before members of Congress tonight and to talk to you about a free program which has been helping tens of thousands of Americans, mostly uninsured, save money on their prescription drug purchases thanks to their county government. By participating in NACO's prescription discount card program, counties have helped American consumers save more than $250 million on over more than 16 million prescriptions through purchases at their local pharmacies since the program began about 5 years ago. The discount cards are actually saving on average about 24% off the retail prescription price. There are more than 1,250 counties that are participating in the program, which represents about 40% of U.S. population. And it's no surprise that in these tough times, really this program is beginning to grow even more and more. In Texas, I'm pleased to report at this point in time that all the counties in your districts are participants in this program. I see my counterpart in Collin County, Judge Self down here. Collin County is one, and I actually have on a table out in the entranceway the prescription cards themselves that you can take with you. There are three key reasons why this program has been effective. First, it's easy. There's no enrollment fees. There's no forms that you fill out. There's no age or income requirements and no medical condition restrictions. Basically, one family can use one card and everybody in that family can respond off of that card. Second, it's free. There's no cost to the county. There's no cost to the county taxpayers, nor to the consumers or the participants. And I will tell you that as the program started, as a bean counter, as a CPA, I kept looking for, okay, how is this possible? But basically, our partner, Caremark, negotiates the discounts directly with the participating pharmacies. Neither NACO nor any participating county receive revenue from the program. And so what we basically have is that uninsured group, the folks who don't have somebody negotiating for discounts for them. In this particular instance, the county government through Caremark is negotiating that discount for the uninsured. Third, everyone is eligible. The discounts are provided free to residents living in a participating NACO member county all across the country. We have a national network of over 59,000 retail pharmacies that honor the card. Any county resident can use it on any prescription that is not covered by their insurance. In some instances, when someone is insured, they'll lay both the cards down, the pharmacist will look at it, and our prescription discount may be better than the insurance plan that they happen to be on. The plan includes seniors, uninsured, underinsured, and especially in some of our counties where they all are operating the county jails. In a lot of instances, they're actually using this for prescription discounts for the inmates. It's truly a valuable card that counties are making available to all American families at no cost to the taxpayers. And so I would invite you to look at the information again that we have outside, and we'll be glad to answer any questions. Thank you.
Joel Allison is President and CEO of Baylor Healthcare System. If you don't know it, on quality rankings, Baylor is right up there at the very top with the best hospital systems around the country. And as the leader of that system, he's pioneered a lot of interesting things, including physician-owned hospitals and other innovations that, quite frankly, are at risk with the current legislation before Congress. Let's give him a warm welcome.
Thank you, Dr. Goodman, and I also want to say thank you to our esteemed congressman for hosting this forum this evening and being here, and thank you for your leadership and your statesmanship on this very important topic. You know, we are so fortunate that we live in a country where debate and engagement in the political process is an honored value. And right now, there is no more important topic, perhaps, on our nation's agenda than health care reform. And I want to also thank everyone who had a part in making this evening possible and for your all's participation in being here because of your interest in this very, very important topic. And I am very honored to be a part of this very distinguished panel and be able to share some of my thoughts and the thoughts of the Baylor healthcare system on healthcare reform as we are dealing with a very, very important, but most of all, a very personal topic, and that's everyone's health. And I'd like to take just a minute, if I could, to give you a little background about the Baylor healthcare system today. Baylor was founded over 150 years ago as a Christian ministry of healing, and we exist today to serve all people, through exemplary health care